Hi guys, how is everyone? Already a warm morning, I guess it is July. Well, thank you guys for letting us come to our coffee conversations this morning. I have the pleasure of introducing some of our outpatient team. They wear a lot of hats, and so I'll let them kind of say what all we're doing this morning. We're going to focus on dermatology, kind of skin items, but we'll have them share a little bit about everything they do. So Tara Lawless, and then we have Lisa Canan. So you guys kind of know how this goes. We'll give a little spiel, but feel free to ask any questions along the way. So hand it over to you guys.
Thanks. Well, thanks for having us this morning. I kind of feel like we're interrupting your coffee, but no? Okay. No, it's good? Right. And coffee. Don't forget the coffee. I'm going to snag some on the way out. So I'm a nurse practitioner at the hospital. I specialize in wound care, all right? And so that's what I do 90% of the time. And as we were talking with our administration, I see people's skin all day long, every day. So way more than their primary providers do. So it just made sense that I start doing some dermatology services because I see the patient's skin all the time. And I do a lot of biopsies and procedures. So it just made sense to fill the gap that we had. Dermatology is a service that we hadn't offered at the hospital for many years. Now, I'm not a dermatologist, right? That's a physician that specializes in skin. I am not that, but I do a lot of referrals with our dermatology providers that are around the area if something comes up that is out of my scope of practice that needs to be handled by a dermatologist, okay? So we're just kind of filling that void that was missing in our care. So that's kind of how it came to be that I took over the dermatology services, and it's been great so far. People have responded really well to it because it's hard to get into a dermatologist. Has anybody tried? It can be tricky. It takes many, many months a lot of times, but if you come to us and let's say you had a spot of concern and we do a biopsy and it's abnormal and it's something that I can't take care of in the office, I can oftentimes get you into a dermatologist sooner because I have the proof that, hey, this is something that's wrong. You need to be seen sooner rather than later. So that is an added benefit, okay? I don't know, what else? Do you guys have any questions? You want me to focus on a certain topic? Yeah.
You have a lot of specialists come in. Why wouldn't we have a dermatologist come a couple times a month?
That's a great question. That is probably above my pay grade, but I will say dermatologists, we just talked about how hard they are to get into. If they're that hard to get into in their practice where they don't have to leave, it's hard to find one that's willing to leave their home where they're so busy, have a waiting list for months, to come outreach. But I know they have tried. I don't think it's off the table. Yes. I don't think it's off the table. I know administration has tried and looking into it actively, but it's hard to get somebody to want to come to an outreach clinic when they have months of a waiting list in their own private clinic. So it's tough, but it's not off the table. But that's why I'm here to help fill that void, albeit not a dermatologist. I understand that. So.
Is there fewer dermatologists as compared to other types of medicine being practiced?
Yeah, I mean, don't quote me on this statistic, but there's only a few, like per each state that go around. Obviously, there's more than that, but they're concentrated, tend to be in higher populated areas. There aren't, as you know, the closest one is Kearney, and then we send to North Platte and Grand Island as well, but there just aren't as many. So it's a tricky specialty, as we've done dermatology. You can do dermatology in primary care all the time. There's nobody that says you can't. Your primary care provider can do dermatology services. It's just if they have the time on top of the visit that you came for. Now, if you go to them for a skin check, then yeah, they would have the time for that. But if you're adding that onto a visit, there might not be time for that. And then the procedure that goes with it. So let's say you have an abnormal mole that they find. Well, a lot of times you'll have to reschedule for a biopsy or something, where we try to schedule our appointments that if we find something, we can take it off and take care of it that day. So, Other questions?
Yes. So we come to you, here's a spot,
Mm-hmm.
you feel like it needs to be biopsied, you biopsy it, it comes back, let's say basal cell. Can you remove it?
Yeah. So that's a good question. It's kind of a two-part, so it depends. when we do a biopsy, we know that we might not get all of the tissue, right? But our goal is to get it all, so we try. So depending on what it comes back as, the pathology report that tells us, hey, that was basal cell carcinoma, will tell us if I got it all or if I didn't. If I didn't get it all, then that would be one, depending on the location, that I would be fine taking it off. Now, there are some where I have had to send to dermatologists that specialize in Mohs surgery, mostly on the face, because basal cell tends to be deeper, and you have to remove a certain margin based on the guidelines for that to be completely removed. And if that's not an area I'm comfortable cutting much further or things like that, then I would send to a specialized surgeon for that. And not all dermatologists are Mohs surgeons either. So, you have to find one of those specialty. But yeah, I just removed one yesterday that was actually a squamous cell carcinoma, but it was on the leg, easily removed. We just didn't get it all on biopsy. So we then came back and did an excision, so removed the rest of it. And then we send that piece back into pathology to make sure that we have verification, yes, we got it all, okay? So yes and no, depending on the location, okay?
Talk to us about moles, Tara.
Oh, moles. All sorts of moles. We all have moles, some people more than others. I'm sure you've heard of the ABCDs. I don't know if anybody's heard that they added an E to it at the end. So when you're checking your own skin, which is very important to do to know your own body, there are certain criteria to look for on, hey, if you think that's suspicious, then you need to come see us. So the first one, A, is asymmetry. So if you were to cut it in half and flip it, does it match or is it irregular? B is borders, all right? Do you have one side that's nice and clean? Does the other side turn really jagged? Is it all jagged? Okay, that matters. You got a nice, perfect circle, chances are you're probably okay. C is color. So we like a nice uniform color is the easiest and just mostly good, okay? But if you start to get variations in color, that can be concerning. D is diameter. So anything greater than 6 millimeters is something that we would be wanting to take a biopsy of, okay? And E is evolution. So this is the biggest one because its evolution is, I've had it forever, but now it's changing. Okay, then that means something has changed and we need to do something. Because, I don't know if you know this, but like birthmarks can turn into cancer, right? Something that you've had forever and ever and has been normal and it's never grown. If it now starts changing, itching, scabbing, growing, it could be something. And we have seen it and it's actually turned into melanoma in this patient. But they didn't do anything about it because they were like, no, it's a birthmark. I've had it forever. I don't need to be concerned about it. Unfortunately, that's not actually the case. You do need to be watching everything, even if you've had it forever, but just follow those rules of A, B, C, D, and E, okay? And that's a good rule of thumb on any of those. Even if one of them changes, especially if two of them on one mole, we would like you to come see us, see your primary provider, schedule with a dermatologist if you're already, met with them, to get those looked at further. Okay. Oh, skin tags. One of my favorite things to remove. So skin tags are more of a nuisance. They're not a problem, okay? They don't turn into cancer. They're not problematic like that, but they are a nuisance. A lot of people get them in their neck areas, armpits. They're a friction kind of cause, okay? They're easily removed, but they are a cosmetic type removal unless they are causing irritation. Sometimes in armpits, they'll get caught on clothing. For women, a lot on the necks, they get caught in jewelry, and so then they get irritation. And so then we, a lot of times, can have insurance pay for removals based on that. They're an easy little fix. We just snip them. Sometimes we do have to numb them because some people have larger ones than others, but some people are like, nope, I just want you to cut them. A nice little trick, if you like essential oils, tea tree oil rubbed in the areas, especially on the neck, if you don't mind the smell, can help prevent skin tags. So just a little fun fact. But easily removed, not problematic, but we do a lot of those in clinic as well. We cut them. We just pull them up and snip. We numb them if they're large. They don't have a blood supply, so they don't bleed most of the time. They're super tiny. Most people don't even feel it. But there are some large ones in certain areas that are more like congenital that we will numb because you're clipping a larger area that it could hurt, and we don't want to cause people pain. But I always let the patient choose because if anybody's ever had numbing medicine injected before, you know that that also hurts. So you kind of get a choice of which pain would you like. If you want me to numb it, I'm happy to do it, but that also hurts with an injection. So, you know, it's a choice for the patient. So they get to choose.
Another great topic, sunscreen, hats, things like that.
Yes, yes. Especially in the summer. Do you guys wear a lot of hats? Do you wear sunscreen? You wear a hat?
I wear a hat when I ride bikes.
Yeah, you wear your hat. Yeah.
But I do wear sunscreen.
So that is important. The problem with the sun, it's great. It's great for our vitamin D. The problem is it's cumulative skin damage, okay? So when you were young is probably when a lot of damage started because we didn't really have, you know, sunscreens, it's not brand new, but it's newer, right? Were you guys told when you were young to put sunscreen on when you went outside? Right, that wasn't a thing.
Baby oil.
Yes. Oh, yes, let's cook your skin up. Yep, just rub it in. We're going to cook it up. So it wasn't a thing. So it's been an evolution in your lifetime, essentially. And what we found is that it's that cumulative sun damage from being outside and the sunburns and stuff that causes these precancerous spots that turn into full cancer areas. All right, and so there is research that shows if you're regular about your sunscreen use now, even after you've had those years of damage, you will decrease your skin cancer risk by a great deal. So it is very important.
Doesn't some studies say that the sunscreen itself is cancerous?
You're not wrong. You've got to pick your sunscreen correctly. You need to be careful. There's chemical sunscreen, there's barrier methods. I mean, if you see me outside, I'll be pretty much in this because I don't get along with the sun very well. I burnt a lot when I was young. I used a tanning bed. Bad decisions were made, okay? But that was then, this is now, so moving forward. So your best option, if you can, would be a very nice clean sunscreen with a zinc base, but those are like the ones that'll white tinge you. So a lot of women don't like those because then you have this white cast. But a lot of makeup brands have changed those. So if you get a good clean one, you can find one with a tint to it so it doesn't leave that white cast anymore. Yeah, exactly. That's what I use every morning. It works really well. There's a lot of different things. But if you, yes, go off the shelf in Walmart and grab a spray chemical sunscreen, yes, you're putting chemicals on your body, so you can't say no cancer risk.
They also advertise some shirts or different UV.
Mm-hmm.
Is that true?
It is true, and it's very effective. Mm-hmm. And you don't have to reapply the
Not
shirts.
just any shirt works though, right?
Yes and no. Any shirt is a barrier, but if you're going to be in extended sun, the reason they're beneficial like that, they do have UV blocking fabrics, but it's the breathability for it because people tend not to wear the long sleeve clothing because it's hot in the summer in the sun, right? It's hot, and so they don't want to wear it. So they're marketed like that so that they're breathable so that you can, hopefully you will wear it because the best sunscreen or sun clothing is the one that you'll wear. If you're not going to wear it, it's not useful at all. You can buy all the chemical-free sunscreen out there, but if it's just going to sit on your shelf and not be used, then it doesn't matter, right? You've got to actually use it. So, other questions? You guys have good questions.
In my bathroom, I have the sign that shows the 3 different kinds of to, be careful to watch for.
Yeah,
But when I had this on my nose,
it didn't fit them. Yeah.
They say that's the hardest to detect because there's no sign.
Yes. Was it a little pink spot?
Not really.
Not really.
It just kind of, I'd scrub my face and
Mm-hmm.
it would just bleed. It wouldn't heal over, and that was the sign you said to watch for.
That's a huge sign, yes. So in case anybody didn't hear that. So she said she was washing her face and just it would bleed in a little area and then it just wouldn't heal. That's a huge sign that something is abnormal and wrong. So if something's bleeding or it crusts and then bleeds and kind of goes back and forth and it just feels irregular, that's a huge sign that something is wrong and changed. One thing that stuck with me in a lot of the classes that I did was, if it's pink, stop and think. So we don't talk about, like I talked about color, like dark colors and things like that, but a lot of the skin cancers that I remove are pink. And people don't think that. They're like, oh, it's pink, it's fine, it's not. Actually, no, not really. So pink is a stop and think, and I take off probably more pink mole or abnormal skin lesions than dark black ones, okay? Because those tend to be a lot of times there for a long time, and a freckle or something like that. So changing really matters. Precancerous lesions, anybody had some of those taken off? We call them actinic keratoses. A lot of times that is the chronic skin damage in their precancerous areas. So if we can get to them before they turn into further cancer, they're much easier to treat. There are topical chemotherapeutic agents that you can use as like a cream that takes off an entire area of them. We can freeze them off. We can cut them off, but then you a lot of times have a scar. Freezing them off is much easier. So there's a lot of options, and those tend to just feel like a rough kind of patch on your skin, okay? When you're feeling your skin, you're like, oh, smooth, smooth, and then a rough patch. If it's not been there, or if it crusts and like comes and goes, that's likely a precancerous lesion and should be looked at, okay? How about skin tears? Anybody feel like their skin is really fragile and tears easily? No? Yeah? So as we age, our skin loses collagen and elasticity, and it's much thinner and finer. Plus, some people tend to be on some medications that can thin the blood a little bit and cause irregular bleeding. And so we see a lot of skin tears in our practice, not necessarily my dermatology side of it, more our wound care side. There's not a lot of things to help prevent that because those are natural processes of aging. It's just preventing the skin. So as we age, our cells don't turn over as quickly. And so we get dark spots on our arms and areas, face, all the sun areas, and our skin gets thinner. So using a retinol-based body lotion can help with that, supplementing with some collagen, but there's a lot of like different kinds out there. So, but that is a natural pace of aging for the skin. So there's not a lot to do with that. But if it is an issue and you're concerned about it, there are some different kinds of lotions that can be done and used for that. And a lot of them are over the counter too. So, because they are cosmetic for insurance's purposes, so insurance doesn't cover a lot of dermatology things, unfortunately, as far as cream-wise at the pharmacy. And they tend to not be cheap, of course. They like their products.
What do you think about tattoos?
In general, or just like in skin? You gonna get one? Have it. I mean, it's a personal choice. So I have had to remove moles like next to tattoos. It's a little difficult because then people are upset maybe the tattoo isn't going to look the same, or we'll do a surgery and they want to try to line up the lines exactly the same, which is basically impossible, right? Like I'm not an artist, so.
But do you see is there a danger of getting a tattoo as far as skin cancer?
It doesn't increase your risk of skin cancer, no. However, it might increase your risk of not finding a skin cancer if the tattoo is large enough that it is covering so much of your skin that you can't see your actual skin, and then you don't notice something changing. So the location really matters, all right? And if you're really checking your body and knowing what is right for you, okay? And what your skin looks like, because that's different than what my skin looks like. Like I'm a very freckly person. I have a lot of areas, and I do have a tattoo, but it's in nowhere that there are moles. Anything else? What else did we cover? Yeah, we do a lot of acne. You have probably grown out of your acne stages by now, lucky you. So, but I mean, if you know anybody that is, that's a big one that clogs up dermatologist offices, probably more than it needs to be, because there's a really good like algorithm of if this doesn't work, we go to this, and we kind of work through the branch. But most of acne is consistency in skincare, right? So if you're not washing your face twice a day, if you're not really taking care of it and doing the things that you need to do, then that's where acne comes in. So there are different causes. There's hormonal and things like that, which are treatable, but that's a huge one that I wish we saw more of in our clinic, but it's just hard to get those younger people in sometimes. So they just think it's something they have to live with. Unfortunately, it leads to a lot of scarring, which causes deformity for life. I mean, it's not something, I don't have a cream to fix the scarring. There's nothing we can do about that. It can't be treated. You have to have laser treatments and things like that. And we found that that in itself causes more mental health harm than some of the medications that we use to treat the acne. So there's been a huge shift over the last, 5 to 10 years in how we treat acne, is that we're trying to push to be way more aggressive because it's really affected, especially younger teenagers, mental health and how they look, because we're leaving them disfigured because we're not treating it soon enough or aggressive enough. And it can be treated. But a lot of it's consistency. It's also hard to get teenagers to wash their face twice a day. I don't know if you remember that, but it's difficult sometimes. So it's tricky, but it's important. So if you have grandkids, kids, anybody, friends, neighbors, let them know that we can help with that.
Painter sports.
Oh, yeah. Mm-hmm. We do a lot of wart treatment too. So, yeah. A lot of things we don't think of. A lot of people come in with plantar warts. There are different kind of acids and things that we do with that. Basically, any skin-related issue we'll take a look at. A lot of rashes. We see a lot of rashes. People coming not knowing what it's from. Even some heat rashes nowadays, just when it's hot. But there's a lot of vascular conditions that can cause rashes, so we treat a lot of those as well. We work very closely with our vascular surgeon too. We're thankful to have her in our facility now as well. So that's been a huge benefit to be able to have her just down the office if I need questions answered or anything like that, because a lot of chronic conditions cause skin issues. And so a lot of times your dermatologist will find them, like psoriasis, a chronic condition, but it can affect many different areas, but often comes up first in the skin. Okay, so there's a lot of different things. But the skin's the largest organ of your body, so it needs to be looked at regularly and taken care of. We don't think of it as an organ, but it's the first line of defense for the rest of your body that is inside and not protected and doesn't have all these extra layers. So your skin is very important. So the more you can take care of it, the better it'll be. Any other topics you want me to cover? Questions? All right.
Just start from the top.
All right.
I forgot to tell my bride I wanted to come early.
I don't really have much else unless you guys have questions. I can certainly talk for days and days on a certain topic, but I don't want to bore you if you're like, oh, I don't want to hear about that. So if you take anything from this, it's please check your own skin, know your own body, check the areas where the sun doesn't shine as well. That's important. That's where they tend to come. Have a friend or somebody check your back or come see us. We'll check those areas that you can't see. All right. Remember the A, B, C, and D, and E. All right. That's very important. If anything is changing, bleeding, crusting, anything like that, somebody needs to take a look at it. Okay.
So don't forget your scalp. That's always very important.
That's a good
found
one.
few
Yep.
Things there.
Mhm.
Between your toes.
Toes are a big
You
one.
hear about
Mhm.
people getting on bottom of their feet. How does that work? You have no sunlight on the bottom of your feet.
That's the concerning part, right? So that's why if you get something on the bottom of your foot, it's likely not a freckle from sun damage or something. It's likely a cancerous lesion. Yep. Yeah. Mm-hmm. So we're always checking the places that the sun doesn't
Nails.
shine.
You
Mm-hmm.
have an abnormality in your nail.
Yep.
Always worth getting checked out.
You can get melanoma in a nail. Mm-hmm. Other questions? Oh, one thing I didn't talk about is, anybody heard of like the skin barnacles? Ever heard that? They're like the stuck-on plaques on the body sometimes. They come with age. They're not cancerous. They look like you could kind of grab them and flick them off a little bit. They're chronic skin damage and sun damage and just age. All right, they're called seborrheic keratosis. They are not cancerous. They're just an age change, but they don't look cosmetically pretty and are kind of scary. So we see a lot of people coming in saying, hey, I have this and it's scary. And I'll look at it and be like, nope, that's normal. But there will be one next to it or something that's close that I'm like, hey, while you're here, though, unfortunately, this one doesn't look super great. So the scary ones tend to be what brings people in, and they tend to oftentimes maybe not even be the concern or the issue. But the issue is if you have concerns and you're checking your body, you're already doing 50% more than most. So you're already working and checking your body. So just being aware of your skin and body and going in to get them checked out if you do see something abnormal. Okay.
I'm sure a lot of these people do live in Lexington, but
Mhm.
we talk about our outreach clinics that we're doing to kind of reach others,
Oh, yeah.
what you're able to do,
Mhm.
kind of your schedule.
Yeah, so we work Monday through Thursday. Like once a month, we'll do a Friday in our clinic here in Lexington in the outpatient clinic. But we've also started to go to surrounding communities to do a dermatology clinic because it's hard to get into dermatologists. So we just went to Bertrand, I don't know, a few weeks ago. Yeah, 2 or 3 weeks ago, and it was very successful. So we have an outreach clinic scheduled for Elwood and then in Elm Creek as well. So all of our outreach clinics to try to bring the services that we provide as a facility, as Lexington Regional Health Center, to the surrounding communities, because that's our goal, is to keep people in their communities, in their areas, because travel can be a large burden. And we can do 90% of what needs to be done, and what we can't, that's what we're here for. That's what happens when we have their phone numbers and we can then communicate with the dermatologists and going from there. So, and most dermatologists' office have, the one I go to has, 25 some providers and only 2 of them are dermatologists. The ones I see are just like me. They're nurse practitioners, just like me, or PAs. So it works out. I'm happy with it. They do a great job, so we can still do the things. It's the communication and the relationship with the people further on if you were to need it. If, heaven forbid, we were to find a melanoma or something, okay, what are our next steps? Where are we going to go next? Okay. We actually also work really closely with our ear, nose, and throat specialists too, because they do some Mohs procedures as well, and that's very helpful for a lot of our facial issues. Our ENT physician, Dr. Klingensmith, has actually my last 2 that needed Mohs procedures on the scalp he took care of for us. So it's just always good to make sure you have those relationships and so that you can take care of the patients. And that's our goal, is to take care of you where you're at and with what you need. And we might not have all the answers, and we won't pretend to, at least I won't, but I can find them for you, and that's what matters.
So if we have a concern, I assume we can just schedule an appointment with you directly.
You can.
Or
Just what I was gonna talk
Yep,
about.
you don't need a referral. Yep.
The number at the bottom here, this 324-8337. My name is Lisa. I also work with Vanjie Vossler. We're both Terrace RNs. You can call this number Monday through Friday. Well, you can call it anytime. It has an answering machine set up to it, but we are there Monday through Friday and can schedule. And we do our own scheduling, so all you have to do is call and we will get you in with what works for you or as soon as possible. We're pretty flexible, so.
We try. And that is a direct line to our clinic. I know some people, we've had some ups and downs with our phone lines in our system. We all know it. So they've worked really hard to fix that. But this is a direct line to our clinic. So if you leave a message, it's only answered by the 3 of us. It only comes to us. So you please do leave a message, because we often are, especially with our wound care patients, all in the room at the same time. So we're not manning the phone 100%. So please do leave a message if we don't answer. Okay, yep, we will get back to you. It's not a clinic-wide answering machine is what I'm saying. So feel free to leave a
Are
message.
you in the hospital or are you in the clinic?
I am in the hospital. I'm in the outpatient section of the hospital. Yep. Good question. Sorry I didn't answer. Anything else? No? Well, thanks for coming. I appreciate it.